Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to show the folks out there how to crack their own back.
You better believe it.
Without a chiropractor or without a physical therapist.
Exactly.
So let's start off.
You can simply use a chair with a back like this. I use my office chair, my computer chair, quite a bit at work.
You really need a specific chair for this, Brad. I mean, the shoulder blades have to fit over the top of this.
Right, if it's too high, it's not going to work.
Right, and if this is not solid, you know, you can't have a flexible back on this, so.
And yep, and then you're going to go back like this and relax. And I usually go like this. And then
Just
I'll,
leans over the back of the chair, so the edge of the chair is using it to
It just
crack
went,
the back.
Bob. Oh, and then I slide down. I'll get different levels too. And I usually go about like to there, and then I'm done.
Some people do it as more like a hallelujah stretch, we call
Sure.
it. They bring their arms up, hallelujah, and then back down again.
Yeah, I'm not doing that though.
So, as an alternative, if you don't have a chair that fits you, sometimes people can kind of put your hand in this position here, and you can actually take your hand, and you can go right up on the spine and push up on the spine.
Kind of angle it like this.
So I'm angling up this way.
And
while I do that, then I lean back. There, it just cracked.
there you go.
So, and you can get different levels that way.
You bet.
You need to have fairly good flexibility with your shoulder on that one.
Right, right.
To go ahead and do that one.
Let's see one laying down, Bob.
All right, laying down would be one with the foam roller.
Sure. Oh, this is one of my favorites too.
So you buy a foam roller. They've got them pretty much everywhere now, don't they?
Oh,
But
yeah.
Just go on to the internet and type in foam roller. And just going to go ahead.
I like the 6-inch diameter for this one, but you could go with the 4-inch.
They have a lot of different textures, don't they, Brad? And you just roll onto it like this. And Brad and I do this one every day, don't we, Brad?
Yep. It's great for your posture.
Yep. I do this one every morning before I run, and you do it before you bike, right? I mean.
Well, yeah, I vary, Bob. I don't have a.
He has a routine that changes every day.
Yeah, but this is a wonder. Can I do it, Bob?
Yeah, go ahead.
Okay. And I like the arch over like this a little bit differently than Bob, and I go right up to my neck. Oh, God, that's good. All right, I don't want to get him jealous.
Next one, we're going to go ahead and do okay, I'm going to be down this way, aren't I now? This is the one for the lower back, and this is a twist, you'd call it.
Sure, yep.
And this one actually doesn't work for me, but it works for a lot of people.
Mm-hmm.
I want you to start on your side, and then I got these bands on here to hopefully you can see better, you know, with my black pants.
Some contrast.
But the lower leg, you're going to go ahead and straighten, and then the upper leg, you're going to take the foot and put it behind the knee.
Right here.
Like that. And then you want to go ahead and flatten your back. So I'm flattening my back. I'm bringing the right shoulder over.
One thing that helps is to bring this
shoulder up a little bit.
This direction.
Okay, now I'm taking this hand, the upper, which was the upper hand.
Right.
And by the way, if you have a disc problem, I wouldn't be doing this
Right,
one, Brad.
right.
And you can start off and get into this real gently. If this is too much, you can just kind of work your way over.
Right.
But then eventually you want to do it, bring the hand out this way, and I'm looking toward the hand, and this hand is actually pushing down like this.
Right there. So spread it out.
So you can take deep breaths, breathe in, breathe out, and push down a little bit. Breathe in, breathe out, push down like this a little bit. Now you can vary this too, Brad. You can the farther you bring the leg up, the farther up on the back it's going.
Yep, yep.
And if you really want to get aggressive, you can actually print the leg over the edge like this.
And none of these should cause any pain.
No.
If they're painful, stop.
Stop, yep. And I'm going to show you the other way real quickly. So again, you're going to start with the bottom leg straight, this leg bent behind with the foot behind the knee.
Right there.
You're going to start straight, working your way towards
This shoulder.
you know, you can
coming
actually
down.
oscillate if you want. Then put it down, bring this shoulder forward. And now this one is there, this one's here. And again, I can take deep breaths and oscillate, or just go ahead and give a little crack, or let it go off the edge here.
Right.
All right, and Brad's got another one. We're just full of them today.
Right.
So
this, when I was younger, used to always give me a crack. And usually, you know, if you're going to get a crack, it's going to happen once and then you're done. You're not going to get repetitive ones. Okay. So this one here, I like to call it the pretzel one. So the right knee is up, left elbow goes over the top, and then you look behind you like you're looking behind your rear window in your car, and then I press here, relax, and just stretch right there. And then I'll
His back is real straight when you're
Yeah,
doing this.
yeah.
You're not bent.
look at it.
Yeah.
Maybe. And it is a good rotational stretch.
Yeah.
And it just feels good. If it doesn't crack, it still feels good. It gives you some good stretch.
Again, we admonish you with all of these. If you start feeling pain with any of these, don't do them.
Exactly.
And I would not do it if you think you suspect you have a disc problem or a herniated disc.
Right,
This,
right.
this would not be the thing for that.
Exactly. So good luck and keep on cracking.
Yeah.